Breastfeeding is the most advantageous, and we do recommend breastfeeding to all the babies. It is not contraindicated except in very rare cases like HIV and all these things. Otherwise it is recommended in all the patients. We normally promote the breastfeeding should be given as early as possible, especially within an hour of the birth, whether it is a normal delivery, whether it is a cesarean. Is the golden hour which we recommend in all babies after childbirth. Basically, it is very important. One thing is the child bonding. Secondly, from mother, all the antibodies, all the immunity transfers to the baby. And the first milk, what we call it as colostrum, is important because majority of antibodies are given through mother to the baby during this period. If we develop breastfeeding in the initial part, it has been seen that babies do better later on. They can settle down better later on. If we delay the breastfeeding for a few days, then these babies take much longer to settle in the breastfeeding part. Ideally, breastfeeding should be given only because it will provide all the nutrition as well as the water content also. So there is no need to give supplementation by water or any other top feed, etc. Ideally, breastfeeding should be continued minimum 6 months, but 1 to 1.5, 2 years it is recommended. One can give. It does help baby as well as to the mother also, because when the babies are sucking, the uterus also tend to contract. So it does involute better. So the parturition or the recovery of the uterine or coming back to normal size also helped by breastfeeding. To some extent later on it does help in contraception also. So I think we need to promote breastfeeding to all mothers.